So one of the biggest disparities that we see is access to care and access to best practices. The vulnerable populations, the immigrants, refugees, low-income populations, they really aren't getting access and regular access to even the basic interventions that we know really can make a huge difference in oral health quality of life. One of the challenges that we see is the distribution of dental providers. We have a lot of areas, especially rural areas, where there are no dental providers available. And if there are dental providers, they may not take Medi-Cal Dental and public insurance program. UCSF works on coming up with creative ways to increase access to care for these rural communities and other areas that do not have a lot of dental providers. One of the programs that we have is a virtual dental home, where we partner with local dental providers like a registered dental hygienist in alternative practice who can do the screenings and some of the basic treatments. And we also bring a lot of our dental students and our dental residents out to different communities to increase access to care that way as well.
UCSF in particular is collaborating to actually bridge that gap so that the care, oral health care, is more equitable to the underserved population. Community-based clinical education is a program for our third and final year students. Our final year students actually get to go into the communities, underserved communities, and actually go through a rotation of 6 weeks. So I think we are making our students more well-rounded by doing this. So when they get out, when they actually graduate from school, they have many opportunities. They really get a good flavor of a dental public health to get out and hopefully help these populations, when they graduate from here.
When I came to dental school at UCSF, I realized I also had a passion for public health. I decided to become a faculty in pediatric dentistry because I felt that I could make the greatest impact in reducing disparities in children's oral health and reducing access to care issues by training other dentists to provide care to children from underserved backgrounds. Dental caries is the most common chronic disease of children in the United States. This is especially prevalent in patients with special health care needs. Children with autism spectrum disorder is a large group of patients with special health care needs that we're able to serve at UCSF Pediatric Dentistry. We have a special clinic where we work with a board-certified behavioral analyst at our dental visits to support children with autism spectrum disorder, to help them to gain the skills that they need to go to the dentist. A lot of times when I meet families and parents of children with special health care needs, they have been looking for a dentist for a long time, and they have not been able to find anybody who was comfortable or willing to treat their child. Our coursework in pediatric dentistry we've revised so that we can better train third and fourth year dental students to feel prepared and confident in providing care to patients with special health care needs when they graduate from dental school. That way, when these dentists go out into their own communities, they're comfortable providing care to patients with special health care needs. This will increase access to care for these patients and help to support health equity so that these patients are able to receive routine dental care in their own community, just like everybody else.